Good afternoon and welcome everyone. It's Melissa McVie here from the Ontario Association of Resident Councils team, and I wanted to say thank you for taking the time to participate in today's live webinar. We'll be spending the next hour with our special guest, Craig Thompson, Ontario's Patient Ombudsman. Craig will be sharing an update about his office's work in long-term care. Before we get started, you'll notice that we've muted your microphones in an effort to eliminate background noise and distractions for our speaker. We have protected time for a question and answer period at the end of today's webinar, at which time we'll invite you to type your questions into the chat box, or you can unmute yourself to ask your question aloud. Today's webinar is being recorded for education purposes and will be made available to all participants following the session. The webinar will also be archived on the OARC website. So without further ado, I'd like to give a warm welcome to Craig Thompson, Patient Ombudsman, and I wanted to say thank you, Craig, for being here. We look forward to getting to know you a little bit better and to hear about the exciting work that your office has been up to.
Thank you, Melissa. Hopefully you can see me and hear me.
Yes, we can.
I think it's always nice to put a face to a name. So thank you, Melissa and Josie Lee, for inviting us to come speak to the Ontario Association of Residents Councils. This is always an excellent opportunity for our office to be able to speak to the residents of long-term care, which is an important community that from the standpoint of myself personally, both my parents are residents of long-term care. And so this community is very close to me. And I have some very personal dealings with the long-term care community and the residents and family councils. So this is really wonderful for me to have a chance to speak with you directly. Just to give you a bit of background as to my role as the patient ombudsman and maybe where I come from. So I've just recently been appointed to the office to be the patient ombudsman just in end of March of this year. But I've been with the office since 2017. So, and the office opened in 2016. So I've been in the office for just over 4 years. Prior to that, I was the executive director, so very much involved with the operations of the office and setting up what is a new organization. And so was still very familiar with the kinds of complaints that we receive from the long-term care sector and also other sectors that we have jurisdiction. But in the role now of the patient ombudsman, I certainly have a different responsibility, not so much in terms of operating the office, but in the role of the patient ombudsman and the head of the organization, then my role becomes much more external facing, to be able to speak to individuals like yourselves and your association to make sure that the services that we offer to the long-term care sector and its residents and families is well understood and that everyone understands where we can help. And I'm hoping that what I'll talk to today with my slide presentation will give you a much better understanding of what our office can do for you and what our role is. So with that, I'll ask Melissa to advance to the first slide and I'll start my presentation. I'm going to turn off my camera just so I can focus, not have to look at my own face. So the question we often get in our office is, what is the jurisdiction of our office, or who do we oversee? So we oversee a large portion of Ontario's healthcare system. So we have jurisdiction over the 141 public hospitals within the province, with home and community care support services. And obviously we have jurisdiction over the 630 plus long-term care homes that currently exist within the province. So as I said, that's a large portion of the healthcare system in Ontario, but it's not the entire healthcare system. And I'll speak to that a little bit further on in my presentation about those areas where our jurisdiction does not cover. Next slide, please. So what is a patient ombudsman? And that's also a question we get often, because not everyone is familiar with the role of an ombudsman or a patient ombudsman. But we offer a free complaints resolution service to all Ontarians. So our office is able to receive concerns or complaints from patients and residents and their caregivers about a negative healthcare experience that they've had within the Ontario healthcare system. So that complaint system, our complaints resolution service, is available to everyone in the province. There are certain restrictions around when you can access our office, but I'll go through those in a few more slides. But ultimately, an ombudsman's office is designed to work with all sides to come to a meaningful resolution. So we're often asked, so are you an advocate for patients? Well, we're an advocate for fairness, and that's where working with all sides comes into place, where we want to make sure that any resolution that we help to come to is fair for not only the resident and their families, but also fair to the health sector organization, because we know that the best resolutions always are the ones where everyone feels they've been treated fairly and they've been able to be brought along in the process in a fair and equitable way, with each person or each party having an opportunity to discuss and go through the experience that they had and the impact it had on them. So that's ultimately the role of an ombuds office, is to find a meaningful resolution by working with all sides. The other part of work of an ombudsman's office is the investigations that we are able to undertake. So generally, we like to deal with the complaints or concerns from patients, residents, or their family members in a more informal fashion, where we're trying to get to resolution through opening up lines of communication and trying to understand where maybe there was a miscommunication occurred or some information wasn't properly shared. But ultimately, an ombudsman office has the ability to conduct a formal investigation. Now, we don't do that very often, but we do have many situations where it's only through a formal investigation that we have the ability to really get to the root cause of the situation, of the concern. And it also allows us the opportunity to deliver formal recommendations, not only to that organization, but also to the patient or the complainant who came to us. And also, we make those recommendations public. So if we're looking to have a broader impact on the healthcare system in its totality, then we would look to in doing a formal investigation so that we have that ability to make formal recommendations. If we are working within the informal early resolution process, as we call it, then we are not making formal recommendations, but we are making suggestions to the health sector organizations as to ways that they could improve their process. Next slide, please. The other aspect of an ombudsman office is we're often referred to as an office of last resort. And what that means is, essentially, a complaint needs to be made with the organization in question first before coming to our office. And that is a requirement of all ombuds offices across any sector. And that really speaks to the fact that, and this just is common sense, that when each of us has an issue with either an organization or an individual, we always want to give them the opportunity to hear what we have to say and respond. No one ever wants to feel like you've gone over their head and you didn't give them a chance to understand a concern that you had and try to resolve it. So that's really what Office of Last Resort means, is that if you did come to our office and, as it turned out, you had not gone to the organization first and asked to relay your complaint and given them an opportunity to resolve it, then we would ask you to return to that organization, and we can sometimes facilitate that so that you give them a chance to understand what it is that you have an issue with. The other aspect of our work is that we help to navigate what is, I think we can all agree, a complex health system, and also refer to the appropriate organizations if our organization is not the organization that can help. So as I mentioned earlier, we have jurisdiction over a large portion of Ontario's healthcare system, but not all of it. So if you had a complaint about primary care, which is, your general practitioner, that is not within our jurisdiction. So we would not be able to take that complaint, but we would certainly be able to counsel you on who is in the best position to take that complaint. And that could ultimately mean that you are referred to one of the colleges that have oversight over those regulated health professionals, like physicians, nurses, occupational therapists, and so forth. So that navigation role is something that we do quite a bit of. And it does speak to the fact that our health system is not always the easiest system to navigate. And we also like to share our findings, as I said, with members of the health system to try to prevent the same issues from happening to others. So again, that's another reason why we would undertake formal investigations, is because we want to be able to make recommendations to our health system partners to make sure that they understand the complaint, understand what the contributing factors are, and so that they can make changes so that it doesn't happen to another resident or patient or family member. So that's a big part of what ombudsman offices work, is to make sure that what we're learning through complaints is communicated broadly to the health system so it doesn't happen to someone else. Next slide, please. So in trying to figure out or help you to understand how we fit in the puzzle of how to complain about a negative healthcare experience, as I said, because we are an office of last resort, we require that you give the long-term care home where you're a resident the opportunity to hear your concern and have a chance to respond. If after that opportunity you still are not satisfied with the response you've gotten, then that is where our office comes into play. And that's where you can communicate with us and reach out to us, and we will happily listen to what your complaint is, learn more about what the organization has tried to do to respond to your complaint, and then depending on the situation, engage in a dialogue with yourself and that long-term care home to come to a resolution that is satisfactory to both parties. So as I also mentioned, if the complaint contains an issue with the conduct or judgment of a regulated healthcare professional, and I mentioned a couple, doctors are a regulated healthcare professional, nurses, occupational therapists. Anytime that is part of a complaint, we will take that portion of the complaint and we will refer it out to the regulatory body that has jurisdiction. So for a physician, it's the College of Physicians and Surgeons of Ontario that has jurisdiction over the clinical judgment and behavior of a doctor. If it was a nurse, then we would refer that portion of the complaint to the College of Nurses of Ontario. And again, that is the regulatory college that oversees nurses, and they would be the ones that would be able to advance that complaint. We always know that in any complaint that we get, sometimes these issues are kind of mixed together. We can have an element with a complaint that is speaks to the action or inaction of the long-term care home, but there could be an element within that complaint that speaks to the behavior and or judgment of a healthcare professional. So it can be confusing, but that is one of the roles that we play, that when you do come to our office, we will work with you to understand what is within our jurisdiction and what isn't, and then do our best to make sure that we take on the work that we can, and if it's not within our jurisdiction, we would refer you to the proper regulatory body. I think the one thing that I can say is, because it can be confusing, and if you're really unsure of who to turn to first, you can give our office a call, and we will help you to understand the process and where you are in the process, That's something that we often do with complainants. So don't feel that that's not an option available to you. Next slide, please. So I'm going to give you a little bit of data that we've received over the course of the COVID-19 pandemic related to long-term care. We released a report back in October, November of last year, which was a special report that was intended to talk about what we had heard in the first wave of the pandemic from the long-term care home sector. As we all know, the long-term care home sector went through a tumultuous, incredibly challenging period where the pandemic disproportionately was impacting long-term care residents, their families, their caregivers, the whole sector. And we saw a dramatic increase in the complaints coming from long-term care, more so than we'd ever seen in any of the years that we've been taking complaints from long-term care. So when we began to see those complaints coming in, we knew that there was a lot of challenges and a lot of negative experiences occurring in long-term care. And so that's why we released this report, so that we could communicate broadly to the system that we'd heard these complaints, that if we were going to prepare for the second wave and beyond of the pandemic, we needed to learn from those experiences. And that was the intent of that report. So I'm just going to touch a little bit on some of the data that was in that report. First of all, in terms of complaints, COVID changed dramatically the nature of the complaints that we received to our office. So when it came to long-term care homes and the complaints related to long-term care, as I said, we saw a dramatic uptick in the complaints coming from long-term care. And those complaints were 73% related to COVID and the pandemic. So traditionally, our office would receive between 10 and 15% of our complaints from long-term care, with hospitals and home and community care making up the rest of our complaints. That completely turned itself on its head during the first wave of the pandemic, where most of our complaints came from long-term care, and at a number that we had not seen ever before. And so we know that COVID was driving those complaints, and as I said, that was why we made an appeal in April of 2020 to the long-term care sector, and particularly to residents and caregivers and families, to come to our office and register complaints, because we wanted to make sure that people knew that they had that option available to them to come to our office to talk about the negative experiences that were occurring in their long-term care home, but B, because we wanted to make sure that we had the data so that we could develop recommendations that would be thoughtful and helpful to the system. Next slide, please. So it's always important to talk about what it was that we were hearing from our complaints. So every complaint that comes into our office, we review it and we begin to break it down into its themes, because every complaint can have multiple themes. And so for us to be able to accurately gather the data that we could then report back, we need to be able to understand what are the themes in play when a complaint comes to our office. So when on the left, you'll see complaint themes. So of the themes, we have visitation as a theme, infection prevention and control, poor communication, quality of care and treatment, restrictions and isolation, staffing shortages, COVID-19 testing, and personal protective equipment. Those are some of the themes, and we do have quite a few different themes that we began to track when it came to long-term care complaints in wave one. Wave one, which was for us March to June of 2020, we received 239 complaints directly impacting long-term care. Now, the number one complaint for during the first wave was infection prevention and control. And I think if we, remember back to that time, that was the real scramble that we saw within healthcare, is how to protect not only residents, but how to protect staff, and how just the general public can protect themselves. So in fact, infection prevention and control was very much a topic of complaint and concern in the first wave, followed by visitation, as we all experienced. And again, as I mentioned earlier, both my parents are in long-term care, so I experienced this myself. The visitation and the restrictions that followed put tremendous weight on the shoulders of family members and caregivers because they lost access to their loved ones. And for residents, I can't imagine the isolation that you began to experience when family members and caregivers were not able to access you in your homes. So that was obviously a big part of the kinds of complaints we were hearing. It was then followed by poor communication. Again, we all experienced the mad scramble to be able to keep everybody in the loop as to what was changing in terms of the policies and protocols, all the different directives that were coming down from the government. Communication was a challenge, but I can always also say that communications has always been a challenge in healthcare. Ever since our office opened, communications has always been in the top 5 of complaints. And then we began the complaints moved into areas of quality of care and treatment, staffing shortages, which we know was driven by the fact that staff were having trouble coming into the homes. The restrictions were not allowing them to work in multiple homes, so staffing became an issue. And then ultimately, personal protective equipment and COVID-19 testing made up the rest of those complaints. Now, when we moved into waves 2 and beyond, things changed a little bit in terms of the kinds of complaints we saw. So in the period between July 2020 and April 2021, we received 276 complaints from long-term care. So a longer period and not as proportionally, not as many complaints as we saw in wave 1, but still a lot of complaints from long-term care that we had, as I said, typically not seen. And what was some of the things that stood out for us in wave 2 in terms of complaint themes was the rise in complaints about restrictions and isolation. And so in wave 1, that only represented 1% of our complaints. And this also was a theme that evolved. So the visitation complaint we saw right away in the first wave when access was lost to residents by their families and caregivers. But the isolation piece to that, where residents were not having the ability to see their family, to have the emotional and intellectual stimulation that comes with being able to see their friends, see their family, engage with staff, that began to contribute to the isolation complaints that we began to see. So that's why we saw the isolation complaints rise from 1% to 12% in the second wave. And we still see that the restrictions and the isolation that comes from that still are having a tremendous impact on the health and welfare of residents in long-term care. We still see complaints about visitation, infection control, prevention and control, poor communications, and so forth. But it's the isolation that is coming from the restricted access that really began to rise in the second wave. And hopefully, with the loosening on the restrictions and the ability for us as caregivers being able to go into long-term care and be with our loved ones, to be with our family members, I think that is hopefully helping, but that still is a tremendous area of concern for us. Next slide, please. So as you can imagine, as an office that takes complaints, we hear complaints typically in the form of a story. People come to us with a situation that's occurred where it's been extremely troubling and negative and emotional for somebody, and we hear it through a story, and it's through the stories that we're able to really have an understanding of what exactly happened and the impact it had on people. But I just wanted to just tell a few of these stories so people understand the kinds of things that we heard, and I'm sure you've got similar stories or similar but different stories, but everyone's stories is important to our office, and that's how we do the work of understanding what it is that has occurred. But we heard people say, "I'm afraid I won't be able to see my dad." Questions like, who will help with feeding? For those of us who have that lovely responsibility, that caring responsibility of helping our loved one with meals, which is really does give the staff some assistance. When we weren't able to go in and to assist with that, that was really troubling. So we often heard that question, who is going to help with meals? People were concerned that their loved ones were all alone. They're all alone. No one is calling me back. Again, speaks to the communications breakdown, where everyone was trying to understand all the information that was coming to them, but no one was really being able to communicate in a clear way that we could all understand. People began to observe the staffing challenges and had the questions like, I don't think they have enough staff. There's, normally people would say I'd see 3 or 4 staff at lunch hour. Now there's just 1. So that's the kinds of things that we heard. Or my mom is in the same room with another resident who might have COVID. This was the concerns around cohorting of residents, so that if there was a suspected case of COVID, that you wanted to be able to isolate that resident from others until that was resolved, until you understood what was going on. And then finally, some of the most heart-breaking stories. My dad died and I didn't get to say goodbye. And unfortunately, that is not an uncommon story that we heard, where loved ones just didn't have the ability to be able to be with their loved one, be with their family in that period when they were palliative and were not with them when they died. And that is a heartbreaking situation, incredibly troubling to our office, troubling to everyone on my team. And we know that the residents and the family members were deeply impacted by these stories. Next slide, please. So as I said, we took the information that we received in the complaints from Wave 1, and we developed a special report and released it with our former Patient Ombudsman, Kathy Fuchs, back in October of last year. And in that report, we first and foremost wanted to honor the voices and experiences of residents, families, and caregivers, and the staff, because it's having the courage to come to our office to tell those stories really is something that takes, as I said, a lot of courage. It's not easy to complain. And considering the pressure and the emotional weight that people were carrying during those days, the fact that people came to us with complaints and shared those stories with us and were able to work with our team, we really wanted to honor that by issuing this special report. Within that special report, we made 4 recommendations that we felt needed to be highlighted, so that what we experienced in the first wave of the pandemic, we didn't experience in the following waves. And so we recommended 4 things. One was to have backstops and contingencies in place for all healthcare providers. And really what that speaks to is any long-term care home needs to be able to have the supports of other organizations. It was asking a lot of a long-term care home to have to deal not only with the pandemic and the impact it was having on residents, but the impact it was having on them as an organization in terms of their infection prevention and control practices, personal protective equipment, and so forth. Being able to rely on a local hospital or other healthcare providers in the community was an important backstop, we felt, for those organizations that really struggled with outbreaks during the first wave. We also wanted a change in approach to visitation. We felt it was not appropriate to completely disallow visitation. We understood the motivations of wanting to protect residents from the COVID-19 infections, but at the same time, there's a balance. And by doing full restrictions, we understood, and we heard this very much in the stories from residents, that there was going to be a knock-on effect of impact on their emotional and emotional well-being and health. And so we wanted to have a different approach to visitation, something that was more flexible, that allowed long-term care homes to operate, recognizing the situation in their own community and within their own home, because every home and every community was going through the pandemic in a different way, and so one size didn't fit all. We also made a recommendation that dedicated resources needed to be committed to communications. Communications in a situation where patients or residents are isolated from their families and caregivers are isolated from their loved ones. That's where communications is essential, and the only communications channel that we had was through the home. And so, if there were not dedicated resources to the work of communications, then we began to see problems with families and caregivers and residents not being fully aware of the situation. And finally, we wanted to have whistleblower protections to be strengthened. And whistleblower protections are for those staff who work in long-term care, who, over the course of doing their work, observe something that is troubling, that they may have tried to resolve with the administration in the past and is not getting dealt with. Whistleblower protections allow them to come to our office, and they can do it anonymously or through whistleblower protections. Then we can work with them in a confidential manner to understand what it is that they've observed, and essentially carry that complaint forward on their behalf while protecting their identity. So those are the 4 recommendations that we made as part of that first report. And it was heartening to see other reports that came down from the Commission and from the Auditor General spoke to some of these, if not all of these recommendations, in the same way. Next slide, please. So just a little bit about the current work that we are doing with long-term care. So we continue to respond to complaints that are driven by COVID-19, but we also are dealing with non-COVID-19 related complaints. And we feel that that's because just the stress that the pandemic has put on long-term care, that those issues and concerns that existed pre-COVID-19 are still there and probably have been exacerbated by that, by the pandemic. So we're seeing record high caseloads from long-term care homes in terms of complaints. We're also investigating in a formal manner the resident and caregiver experiences that occurred during the pandemic. So we have initiated a formal recommendation or a formal investigation. This investigation is underway now. It is looking at all the long-term care homes within the province that experienced a COVID-19 outbreak, and we have chosen a selection of long-term care homes that we are doing a much more deep, intensive review of their response to those outbreaks. We have also just issued a provincial survey. So as I said, we're doing a more intensive review of a selection of homes We obviously cannot look at all homes, of which I think there was in the neighborhood of 100 homes that had outbreaks over the course of the pandemic. So we've done a provincial survey to gather information from families, residents, caregivers, and staff across the province. So anybody connected to a long-term care home who had an experience that they want us to know about or a story that they want to tell, then through this provincial survey, we're going to be gathering that information and delivering a special and bringing that information forward in the fall, so that we learn from those experiences from anybody who was impacted in long-term care during the pandemic. We are also issuing another special report, number 2, specific to COVID-19. As I mentioned, our first report was dealing specifically with long-term care. This report will actually report on our findings related to our complaints for all 3 sectors that we have jurisdiction over. So not only long-term care, but also home and community care, and also the public hospitals. So that special report is due out this summer. And we continue to engage and raise awareness with resident councils like yourselves and family councils. And we're always happy to attend these sessions so that we can talk about what it is that our office is able to do for you to support you and your loved ones, and to make sure that you are aware of what we're hearing about complaints within long-term care. Next slide, please. So just again, in speaking a bit more about our investigation, the investigation into long-term care homes is specific to those homes that had a COVID-19 outbreak. And what we're focusing on in terms of themes is visitation restrictions and those protocols surrounding those restrictions. Again, communications, including the timing and the type of information that was made available to residents and families. We'll be looking at staffing levels, how those staffing levels were impacted by directives that came from the government, and how long-term care homes responded to those staffing challenges. Infection prevention and control practices and protocols, how those evolved from the beginning of the pandemic towards the end of currently where we are now in the pandemic, and then access to personal protective equipment, or PPE. Those are some of the themes that we are doing a deep dive on as part of that investigation. And that investigation will be out in early 2022. The next steps in that investigation include witness interviews and gathering of evidence. As I said, we have targeted a selection of long-term care homes that we are doing specific, more intensive review, and we are calling witnesses for interviews and gathering evidence. We will be then writing our recommendations and the report based on our analysis, and looking to be able to give those long-term care homes that we are investigating an opportunity to respond to what we found. Again, that's just part of the work of our office and of an ombuds. Whatever findings we have, we always want to give those organizations that we are working with an opportunity to respond to what it is that we found. That just is fair and the best practice. We will then issue a final report to the government in early 2022. And again, because it's a formal investigation, we will make formal recommendations. And then we hope that this gives the opportunity for the long-term care community to reflect on those experiences and to improve on those experiences. So that ultimately is the goal of the investigation, is to have the experience for everybody to improve, and that we don't have to experience what we went through for this first part of this pandemic. Next slide, please. So as I mentioned, we are, as part of our outreach, launching a provincial survey so that we can gather the experiences of everyone across the province who had interactions with long-term care. And so that survey is now available. It's predominantly an online survey, but that doesn't mean that's the only way that you can respond to that survey. There's many ways for us to provide that survey either in paper format or other ways for us to accommodate individuals so that they can have their voice heard. But that survey is now available, and we really encourage all residents, all their families, their caregivers, and the staff within the long-term care homes to respond to the survey. And today we've had some excellent response. And so we're really excited that people are taking the time and having the courage to talk about the experiences they had and tell their stories. Next slide. So, I mean, the other aspect of what this experience survey allows us to do is we know that everyone's not comfortable voicing their concerns through a formal complaint process. So this gives people an opportunity, because it is anonymous, to talk about their experience without feeling the added burden of having to make a formal complaint. It's also another way for residents to make sure that their voices are heard and that they can share their concerns. Again, if it doesn't constitute a formal complaint or something that you feel merits a formal complaint, we still want to know about the experiences that you had in your homes, so that we can make sure that that information gets reviewed by our team, and also that's something a story that we can tell so people understand what it is that people went through. And again, this is for all residents, staff, families, and caregivers who had any interactions with long-term care within the province of Ontario. Next slide, please. And as I said, predominantly this survey is available online, but we're very happy to make paper copies available to your long-term care home. We can send those out to you, and then with a prepaid return envelope to make it as easy as possible. We can also arrange an appointment where you would be able to speak with one of our staff members to complete the survey, and they would go through the questionnaire with you and document your responses. So that's an option available to you. But either way, if you had any questions about how you'd like to be able to respond, or ways that you feel we could make this more available, then I encourage you to speak to Jason Oliver, who is on our team, and Jason's email is there along with his number, and Jason would be very happy to assist you in completing the survey and making sure that we make it available to as many people as we can. And that includes if English is not or English or French is not your first language, then we're very happy to translate that survey into any language that you need. And I think that is.
Thank you, Craig. It's Melissa here from OARC, and while we're on the topic of the survey, I'm not sure if you mentioned, but how long will this long-term care experience survey be open for people to complete?
The survey will be open until the end of June. And Jason, if I'm pretty certain that's our timing, but essentially for another period of time, another couple weeks.
Yeah, that's accurate. And if we need to extend for any special accommodations, we're happy to do that. So if anyone needs a little extra time, we can happy to accommodate that.
Thank you. My colleague Jennifer has put the link and some information into the chat box. So that's another way that you can access it, in addition to the contact information for the Ombudsman office, the Patient Ombudsman office. We've got some great questions coming through. So
Wonderful.
I guess we can just jump right into them if that's okay with you, Craig.
Sure.
So there was a comment from Mary Nestor. Thank you. This is excellent information for all to ponder. How does your office interact with the Ministry of Long-Term Care Homes Inspection Branch and their complaints process, including mandatory reporting under the Long-Term Care Homes Act?
So I'll start with the inspections branch. So if we hear a complaint that meets the criteria for a you just mentioned, I just blanked on the name of it, but it's a required report. Then we would reach out to the inspection branch and make sure that they're aware of a situation where there could be an allegation of abuse or neglect. When any complaint that sort of falls within that criteria, then we do a mandatory report to the inspections branch. So that's one way that we interact with them. Our interactions with the Ministry of Long-Term Care, and this is something that we experienced during the pandemic, and particularly in wave one. Anytime as we began to track complaints and we began to see patterns where, particularly around visitation or communications, where we felt that there was a benefit for us not waiting for a report or waiting for us or an investigation, to relay that information to the ministry so that they could A, be made aware of it, and B, take action, we did. So while we don't have any reporting accountability to the ministry, in terms of we don't, an ombudsman is an independent office, we do communicate with the Ministry of Long-Term Care and the Ministry of Health in those circumstances where we feel there is benefit to the broader community in long-term care, that they understand what it is that we're hearing and work to address those concerns as quickly as they can, without us having to issue a formal report or initiate an investigation. And I think there was a third element of that question beyond the mandatory reports in the two ministries. Or did I hit the mark on that?
I think you got both components. Mary, if you have any follow-up questions for Craig, feel free to jump in to the chat there again. Thank you.
I can also speak to our interactions with homes themselves. So when we get a complaint about a situation within a long-term care home, then we will engage with that long-term care home, the administration, really whoever in that home that we need to, in order to understand the concern and to work to a resolution. So we do that in every case where a complaint comes to us specific to long-term care homes. We will engage with that home directly.
Thanks, Craig. I think Nicole's question is around the survey, I believe, and she's asking, is this just for long-term care or retirement homes as well?
It is just for long-term care homes. So retirement homes are not within our jurisdiction. So they are, well, there's a lot of affinity between the two sectors, and I'm sure they experience somewhat similar concerns and challenges during the pandemic. Retirement homes are not under the jurisdiction of my office, and so if someone did have a complaint about a retirement home, then they would go to the Association of Retirement Homes that has jurisdiction. So if you have if you do have a story about a negative experience in retirement homes, it wouldn't be something that you would come to our survey to communicate.
Thank you. Our next question comes from Amy. What happens if you cannot come to a resolution with the home related to the concern that was brought forward to your office?
Well, there's a couple options we have available to us, and typically we do get to a resolution. In most cases, we do come to a resolution. Well, I will be quite honest and say not everyone is always happy or excited by the resolution we get to, but that's kind of the nature of our work. But people are satisfied that we've got to a fair resolution. But ultimately, if an organization doesn't see the merits of what it is that we're trying to achieve, and we don't get to a resolution, we could decide to investigate and move to a formal investigation. The formal investigation gives us the opportunity to dig a little bit deeper. We have a few more powers in order to be able to request the cooperation administration and staff, or to ask for particular documentation if we feel that we haven't been able to get to the root cause of a situation. And then, as I said, with investigations, we can make formal recommendations to the organization, which we always share with the complainant as well. And the other thing that Ombuds can do is we can share those recommendations publicly. So we always have that option of being able to share recommendations publicly. So if we felt that a recommendation that we made had merit, and without it that we would not be getting to a fair resolution, then we could make the decision to share that publicly, to make sure that the system as a whole understood what it is that we had seen and what we felt was the gaps in play. To date, we have not done that in a long-term care home.
Thank you, Craig. We've got another question that's come through from Linda. The question is, do ministry inspection staff tell your office about resolutions of complaints that they've investigated?
No, they do not. And their investigations, the jurisdiction or what governs their investigations is the adherence to the Long-Term Cares Act. So that's a very specific accountability that they have. So they're looking at the adherence to elements of the Long-Term Care Act. What we look at is the experience of residents, families, and caregivers in relation to long-term care. So very different kind of domains of accountability. So they do not report to us their findings. Obviously, we have access to their inspection reports, like everyone, but we don't have that. There is not that kind of reporting relationship between the inspection branch and us. But as I said before, we are looking at the experiences in very different ways. As I said, they really look at adherence to the Act, and we look at the experience of residents and families.
Thank you, Craig. We have a question that's coming through from a resident, from Gail. Gail's expressing some concern about references in your report when you reference isolation. Does this reference capture the full extent of what residents have experienced? Being denied access to family is one aspect, but there are many more hours in the day that residents have and have had no stimulation. Does the report include this incredibly important reality? So it's not just that isolation from families is what Gail's getting at.
Well, thank you, Gail, for that question, because that is really an important distinction to make. The separation from family and caregivers is one part, but residents the whole day, they can be experiencing isolation from the activities, the emotional support, the interactions that you had with your fellow residents and staff. That's another big part of it, and that's where we're hoping also that the survey is going to help us to uncover exactly what was the other aspects of that isolation, all the other negative impacts that came from just not having the access to what was a normal aspect of your lives before COVID, and that the isolation, as you said, was one part of it was not being able to get access to the outside world, which is families and caregivers, but the other part is internally those experiences you went through. So we're hoping the surveys will uncover that aspect of it, and that's another area of the story that we want to be able to tell. In the investigation part, we did what we call impact statements. So every of the half a dozen long-term care homes that are being formally investigated by our office as part of our formal investigation, we have requested and received many resident impact statements. And those impact statements really speak to, I think, what you're speaking to, which is the not only the isolation from families and caregivers, but how things in the home were experienced, how things changed, how meals were altered, the meal experience, how interactions with staff, other residents, activities, being able to go out and socialize, all that in some cases came to an end during this period. And so those impact statements, I can tell you, are pulling through those stories, and we will be looking at those intensely and doing our best to be able to articulate that as best we can, so people understand truly what happened and the impact it had on residents. So thank you, Gail, for that, for again reinforcing the fact that it's not just isolation from family and caregivers.
Thank you, Craig. I know we're nearing the end of our time together. We've got about 4 minutes left and 2 more questions are popping up here. So our next question comes from Linda. Do you include a review of licensee non-compliance information when investigating a related complaint?
Yes, we do. So we would, as part of our evidence gathering, we would be looking at those reports and those non-compliance reports. How it factors into our analysis it really depends. But they are investigators, and we have a small team, but a mighty team that is looking at that. They are looking at all aspects, including those reports, because what we're looking at is the actions and inactions of long-term care homes in their response to a COVID-19 outbreak. So that would have some bearing on their response, those reports. So yes, it's part of the mix of evidence, but how, in terms of the balance as to how it informs an investigator's ultimate recommendations, is different for every situation.
Linda says thank you. There's also some compliments coming through, Craig. Just thank you, excellent presentation. We've got another question from Sarah, and I think you did touch on the expected time frame to produce your report. I believe you said 2022, but could you confirm that for us, Craig?
Yes, so we've issued already one report in October of last year. That was special report number 1 with related to complaints in long-term care. Special report number 2, which will be again a about the COVID-19 experience, will include long-term care and hospitals and home and community care. That will come out in the summer, this summer. And then our formal investigation, which we are continuing to work through, will come out in 2022, so in next year.
Oh, thank you. Thanks for making that distinction. That's great. I knew there were a few moving parts.
I did also, but the results of the surveys that as part of this provincial survey that's underway now and ends in June, we will be releasing those results in the fall.
Great. And I'm sure this information will be relayed through your website, but also cross-promoted through the OARC's newsletters and outreach as well.
Definitely, and webinars like this. Happy to come back and talk about those reports or anything that you feel would be helpful to the residents.
Wonderful. Well, we've made it to to just about 3 o'clock now, Craig. This has been so informative. So on behalf of OARC and our wonderful group of participants, thank you. Thank you for your time. It's really evident that you and your team are intimately connected to resident and family experiences and are equally committed to supporting optimal outcomes now and as we move forward. So thank you for being part of this webinar. We look forward to hosting you again in the future. I know you've written some excellent articles. Your team has written some excellent articles for our publications, and we really value having you as a support.
Well, we value this relationship as well. It's very important to us, and as I said, anytime that we can assist and come speak to the residents, councils, happy to do it.
Thank you, Craig. Thank you to Jason, who's behind the scenes relaying some helpful information as well. Just a reminder that this webinar has been recorded today and it will be available. So if there's anyone in your homes or communities that have missed it, you are welcome to share this with your resident council groups, families, and teams following today's session. So thanks again. Have a wonderful afternoon, and we look forward to hearing from you soon. Thanks,
Thanks,
Greg.
Melissa. Take care.